Hi everyone, welcome back to my channel. This is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to look at asthma. So if you haven't yet liked, please do like, share and subscribe. So what is asthma? Asthma is a chronic inflammatory disorder of the airways that is characterized by reversible airflow obstruction and bronchial hyperresponsiveness. And asthma causes episodes of wheezing, breathlessness, chest tightness, and cough, especially at night or early morning. So what are the types of asthma? So there are mainly different types of asthma. For instance, one type is allergic, which we also call extrinsic asthma, which is triggered by allergens such as dust, mites, pollen, and animal dander. And then we also have non-allergic or intrinsic asthma, which is triggered by cold air, exercise, stress, or respiratory infections. We can also have exercise-induced asthma, where symptoms are triggered by physical activity. We can have occupational asthma, which is triggered by exposure to workplace irritants such as chemicals and dust. We can also have cough variant asthma, where there is chronic dry cough as the main symptom. And we can also have nocturnal asthma, which worsens at night and often disrupts sleep. So what are the causes and risk factors? So mainly it can be due to genetics, especially family history of asthma or allergies. We can have environmental triggers such as smoke, dust, strong odors, or air pollution. We can also have respiratory infections. Obesity, cold weather, or cold air can also be triggers and causes and risk factors. And also certain types of medications, for instance, beta blockers. We can also have drugs such as aspirin causing asthma. So what is the pathophysiology? The pathophysiology involves four things. There is bronchial constriction, mucus production, airway inflammation, and airflow limitation. So for bronchial constriction, this is where there is tightening of smooth muscles around the airways. And then there will be mucus production, where there is excess mucus which clogs the airways. We can have airway inflammation, where there is swelling which further narrows the bronchioles. And we can also have airflow limitation, which leads to symptoms and reduced oxygen exchange. So what are the signs and symptoms of asthma? We can have things such as wheezing, where there is high-pitched whistling sound during breathing. We can have shortness of breath. We can have cough, chest tightness or pressure, fatigue, and sometimes these symptoms may worsen at night or with exercise or exposure to triggers. So what are the asthma triggers? We can have things such as allergens, for instance, pollen, pet dander, mold, or dust mites. We can have irritants, for instance, smoke, strong smells, and pollution. We can also have exercise as a trigger, cold air or weather changes as a trigger, respiratory infections such as flu, colds. We can also have emotions or stress being triggers. We can have certain foods or preservatives such as sulfides being triggers as well. So what's the diagnosis? The diagnostic investigations we can do. So first we can take your history and physical exam, and then you can carry out pulmonary function test, where you use a spirometry to measure the forced expiratory volume in 1 second or the peak expiratory flow. You can have allergy testing. You can have the chest x-ray to rule out other conditions. So what's the treatment and management? So mostly the goal of the treatment is to control symptoms, prevent exacerbations, maintain lung function, and avoid emergency visits to the hospital. So for controlling medications, you can have things such as inhaled corticosteroids, for instance, budesonide. You can have long-acting beta agonists, for instance, formoterol. You can have leukotriene receptor agonists, for instance, montelukast. Yeah, you can have reliever medications for quick relief, such as short-acting beta agonists, for instance, salbutamol. You can have anticholinergics, such as ipratropium bromide. You can also have systemic corticosteroids for acute severe attacks. Yeah. So what's the complication of asthma? So asthma attacks, severe asthma attacks can lead to status asthmaticus. You can have respiratory failure, you can have frequent hospitalizations, decreased quality of life, yeah, and even mortalities if poorly managed. So how do you prevent asthma? So mostly you avoid triggers. For instance, if the trigger is cold weather, you make sure you keep warm, adhere to treatment, use a spacer, Foracort inhaler, yeah. Monitor the peak flow. You can quit smoking, manage stress, and exercise regularly, yeah. So those are just some of these preventive measures and lifestyle tips. So this was a brief discussion on asthma. See you in the next video. Thank you.